Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Transvaginal tape. Discharge instructions. Introduction. After your hospital stay, your healthcare providers will give you self-care instructions before you go home. These are called discharge instructions. The nurse and other staff should explain them to you. Make sure you have written instructions too so you can take them home and review them. This program explains general discharge instructions for the transvaginal tape procedure. Make sure to discuss discharge instructions specific to your medical condition with your doctor and nurse. Activity. When you go home, you need to walk several times a day to prevent blood clots from forming in your legs. When you sit down, try to prop your legs on a stool to prevent this. To allow your body to heal, you should not do any of these things until after your follow-up appointment. No heavy lifting of anything more than 10 pounds. No heavy housework. No driving. No sex. No work. Diet. You can resume your usual diet as soon as you feel ready to do so. Patients who have had anesthesia may feel nauseous the first day after the operation. Soups may help settle the stomach. It is important to drink a lot of fluids to avoid getting dehydrated. Constipation is common after surgery. It may be necessary to take a stool softener for the first month. Foods that can help resolve constipation are pureed prunes, applesauce, and oatmeal. Drinking plenty of water and moderate exercising also helps. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Incision. Your incision, if any, may have been closed in one of many ways. If closed with staples or stitches, the incision should be kept dry until the staples or stitches are taken out, usually within 7 to 10 days. When closed with special skin glue, the incision may not need to be kept dry. A shower is usually permitted, and the glue peels off on its own within 10 days. Medications. Your doctor or healthcare provider will explain the medications you should be taking. You may need some of these medications, such as pain pills and antibiotics, for a short time. You may need to take others for a longer time. Make sure you understand which medications you should take and how often and for how long you should take them. Most importantly, make sure you understand the reason for taking the medications and their possible side effects. Check with your doctor or healthcare provider to see if there are any over-the-counter medications you need to avoid. This is especially important if you are taking blood thinners. It is always a good idea to ask your healthcare provider or your pharmacist about any new over-the-counter medications or supplements you may want to take. Be sure to tell your healthcare provider which medications you were taking before your admission and which you should continue taking after your discharge. Ask your healthcare providers to contact your family physician and tell him or her what you had done in the hospital, what to expect, what type of follow-up is needed, and what medications you went home on. What to watch for. Call your doctor or nurse if your incision becomes red, hot, or swollen or starts to leak. Your temperature is greater than 101 degrees Fahrenheit. You have any severe leg pain, swelling, or chest pain, which may be signs of potentially deadly blood clots. You have persistent nausea or vomiting. You have severe pain. You should also call your doctor if you are unable to empty your bladder. You have pain when you urinate. Your urine has a foul smell. You have a foul-smelling vaginal discharge. You are passing urine through your vagina. Passing urine through your vagina may mean that there is a connection between the bladder and the vagina, which is extremely rare. You should also call your doctor or nurse if you have any questions or concerns. Remember, there are no stupid questions. Just ask. Do not be afraid to ask any questions related to your health and recovery. Here is a list of 10 common questions you should ask your doctor and healthcare provider before you go home. 1. What medications should I take and when? 2. What are the signs of infections and other common complications? 3. What should I eat? 4. What will happen to my stitches and staples? 5. When will I see the doctor again? 6. When can I drive my car? 7. When can I go back to work? 8. When and how can I shower? 9. How much weight can I lift? Can I bend? 10. When can I make love again? If you like this video, please like and share. For similar videos, subscribe to our channel. Follow-up. You will need to set up an appointment with your doctor or healthcare provider in a few weeks, sooner if you need stitches or staples taken out. At the follow-up appointment, make sure to bring a written list of questions. These are examples. When can I resume my usual activities? When can I have sex? When can I drive? When can I work? When can I play sports? When can I travel? What are my restrictions and for how long? Do I need any more therapies such as physical therapy? Do I need any more follow-up appointments? Which medication should I keep taking and which can I stop taking? Ask your physician to share his or her findings and instructions with your family physician and preferably with all your physicians. For this reason, it is important that you bring a list of all your doctors with their addresses, phone numbers, and fax numbers. Thank you for using Explain.